Hello friends, so let's see Fmge July 2024 recall session. First, CPR compression ventilation ratio in two rescuers. As per ACC guidelines, push hard and push fast. Push hard means at least 2 inches, 5 centimeters should be pushed chest, and 100 to 120 per minute compression should be given, and 30:2 compression rescue breaths ratio should be there in a case of advanced airway. And also how to you should also allow effective elastic recoil so that heart recoils back. And also for monitoring the CPR quality, we'll be seeing end-tidal carbon dioxide, okay, EtCO2, to monitor CPR quality. This is as per the ACC AHA guidelines, which is followed throughout India. Next, ECG question was given, which was showing MI. So in any case of MI, how to localize? First is the leads facing the myocardial infarction will be showing ST elevation. If it is the anterior wall, then the chest leads V1 to V4 will be showing ST elevation. So anterior wall MI will be having ST elevation in V1 to V4. If it is lateral wall, then it will be V5, V6 and 1 and AVL. If it is inferior wall, then the inferior leads, which are 2, 3 AVF, will be showing ST elevations. Okay, so here it is anterior leads that are showing ST elevation. So it is anterior wall MI, and you are also able to see reciprocal ST depressions in the inferior leads 2, 3 AVF. So it is anterior wall myocardial infarction. Features of primary hypothyroidism they have asked. So how does this hypothalamus pituitary thyroid axis act? From the hypothalamus, what hormones released? It will be hypothalamus will be releasing the thyrotrophic releasing hormone, which is TRH. And the TRH will act on the pituitary, and this will make the pituitary to release THS, thyroid stimulating hormone. This TSH will start acting on the thyroid gland to produce T3, T4, which are the thyroid hormones. So if it is primary hypothyroidism, then the primary disorder is within the thyroid gland. The thyroid gland is not functioning well. So what will happen? T3, T4 will be decreased. So by negative feedback, the other hormones, which are TRH and TSH, will be increased. If it is secondary hypothyroidism, then the damage is happening to the pituitary gland. So pituitary is not able to release its hormone, which is TSH. If TSH is not released, T3, T4 will also be not released. By negative feedback, TRH will be increased. Whereas in tertiary hypothyroidism, the hypothalamus will be crying. It won't be functioning. So here all TRH, TSH and T3, T4 all will be low. So here in exam it was asked only primary hypothyroidism, which was low T3, T4 and high TSH. Area in the fifth intercostal space, 1 centimeter immediate to the midclavicular line is the where your apex beat is felt, which is where you will be auscultating for the mitral area. And the left lower sternal border will be the tricuspid area, and in the second intercostal space, if it is in the left side, then it will be pulmonary area, and right side will be the aortic area. This they have asked in a match format. Next is normal GFR in a healthy adult. They have asked. It is nothing but 120 or 125 ml per minute. So what is the calculation? What is the formula used for this calculation? Is Cograft-Walt equation, which uses age, weight, serum creatinine, as well as gender is included. Okay, 140 minus age by 72 into serum creatinine into weight into 0.85 if it is female. Is weight is replaced by race in case of MDRD formula. This is the latest formula followed throughout for GFR calculation in India. Next, 30-year-old male presented with inability to open the mouth and also muscle weakness. So diagnosis of botulism was made. They have been basically asking the mechanism of botulinum toxin. So let's see how botulinum toxin works. Yes, so what happens is when the action potential starts traveling through the neuron to stimulate the muscle fiber for contraction, it produces acetylcholine. This acetylcholine is packed in vesicles. This needs to be fused in the presynaptic area so that this acetylcholine is delivered to the muscle fiber for contraction. For this fusion, there are 3 proteins needed. One is synaptobrevin, another is syntaxin, and another is SNAP protein. Okay, so this SNAP protein fuses the synaptobrevin and syntaxin and makes the acetylcholine vesicles exocytose into the synaptic cleft. so that acetylcholine acts on the acetylcholine receptors on the muscle fibers that will stimulate the muscle contraction. This is the normal physiological process. Here our botulinum toxin actually eats the SNAPs protein. It makes the SNAP protein dysfunctional. So now this synaptobremin and syntaxin can't fuse. Now what will happen? No acetylcholine and no muscle contraction, leading to flaccidity of muscles. Okay, so this botulinum toxin acts on this SNAP proteins. Okay, next question. Diabetic patient came to the emergency with hypoglycemia. Drugs causing hypoglycemia. See, any drug having the tendency to release insulin will cause hypoglycemia. Metformin is a drug which increases the peripheral resistance. It has nothing to deal with the insulin release. Vildagliptin is DPP4 inhibitor. It also nothing has to with insulin release. Glimepiride is a sulfonylurea which stimulates release of insulin. So this is the drug potential to cause hypoglycemia, whereas metformin and vildagliptin don't cause hypoglycemia. Next question, what they were asking was the CSF findings in various kinds of meningitis. How it is. You should be knowing. First is the cells differential leukocyte count and sugar, protein and culture, gram stain and culture sensitivity. This you should be knowing for each kind of meningitis. First is acute pyogenic, which is bacterial meningitis, where your bacteria as well as your neutrophils. This is the purely mediated by acute inflammation, acute pyogenic meningitis. Neutrophils are the key players. Cells will be enormously increased, and due to this severe inflammation happening, that will lead to exudation of protein, and sugar levels will be consumed by your inflammatory cells as well as bacteria. So very low sugar levels, and gram stain can be positive or negative depending on the causative bacteria. Whereas in TB, if it is the acute stage, it is still mediated by neutrophils. If it is in the chronic stage, then it is by lymphocytes. Here also inflammation will be there, but not that severe as APM. So in chronic type, there might be lot of protein exudates appearing, causing appearance of cobweb in CSF. And in TB, there will be AFB or CBNAT will be positive. And in viral, it will be giving a normal picture of CSF or mild increase in cells, which will be the lymphocytes. And for diagnosis, sugar protein will be absolutely normal or mild increase or decrease. Diagnosis, viral, DNA, RNA, PCR should be done. In exam, they have asked acute pyogenic meningitis CSF picture. Next is in myasthenia gravis, the most sensitive test they have asked, it is the single fiber electromyography. In this, what they will do is they will repetitively stimulate the muscle, and they will be finding this decremental response after repetitive stimulation. Thanks for watching. Do subscribe us for further videos like this. Best wishes.